Right. Hello, everybody. Welcome to our webinar for today. This is part of our redetermination learning series. And today we are bringing you the topic of understanding referrals to and from OHP and beyond. Really what this is about is when people are no longer eligible for OHP and they might get referred over to healthcare.gov, or if they apply at healthcare.gov for a private plan and they're referred over to OHP because they look to be eligible for OHP, how do our systems interact? And what do you need to know as an assister to help your members and clients manage that interaction? Because it can get a little bit tricky having two systems. And there are some risks when people are moving between these two systems. So today, we're going to be talking about some of those risks, what you can be looking for, and how you can help folks. Now, for those of you who have never and are not going to necessarily help people with private plans on the marketplace, some of this might feel deep and in the weeds to you. You might especially be interested in our last section, which is how you can help. But what we're hoping today is that everybody starts to get a sense of this bigger picture, what is available to people outside of OHP, and how to coordinate between the two systems. And you'll have lots of time for question and answers. We have a whole team of people here. If we can go to the next slide, we would like to do some introductions. So I'm Deanna Simon. I'm on the Community Partner Outreach team at Oregon Health Authority. And we also have Christina Hernandez. Can you say hello, Christina?
Hello, everyone. Christina Hernandez, Regional Outreach Coordinator with CPOP for Southern Oregon.
Thank you for helping to create this content and for being here to support it. And of course, we have so many teams at OHA and ODHS supporting all of you, our community partners, and we have a lot of them here today. So we'd like to first introduce our medical eligibility policy team for Magi Medical. I'm going to start with Crystalline, then Christy, and then Yer. So Crystalline, can you say hello?
Yeah, hi everybody. This is Crystalline Franklin. As Deanna mentioned, I'm with the Medical Eligibility Policy Analyst team, specifically with the Magi team.
And Christy.
Good morning. This is Christy Taylor. I'm also with the Magi Medical Eligibility Policy.
And Yer, who will be giving a lot of today's presentation.
Good morning, everybody. I'm really happy that you're all here, and I hope that you're able to leave this webinar with lots of key and valuable information to help you do the important work that you do every day. So thank you for being here.
And we also have we have Janelle here from ODHS APD for an acronym, but Janelle, I'll let you say more about your role.
Hi, thank you. Yeah, this is Janelle White. I am a policy analyst for aging and people with disabilities, often referred to as the non-Magi programs. Thank
you. And we also have our partners over at the Oregon Health Insurance Marketplace. I put one person here, Carolyn, but first, Anadina, would you like to say hello?
Hi, good morning, everyone. I'm Anadina with the Oregon Health Insurance Marketplace, the Marketplace Transition Project team.
Thank you for being here. And Carolyn, who will be helping to present some of these slides. If you can say hello.
Hello, I'm Caroline Black with the Oregon Health Insurance Marketplace. I am the Senior Outreach and Education Coordinator, and I serve Central Oregon, the Gorge, and Lynn and Benton County. Thank you.
I think I knew too many Carolyns and not enough Carolines, and I need to adjust. Thank you. All right, next slide. All right, today we're going to, we've already gone through how to use GoToWebinar before we started the recording, but we will also go through some background about redeterminations and the unwinding and really this renewal process that we are headed into. Just to level set, we will not go deeply into it because we have other webinars that we are referring you to for deeper information. But then we're going to be talking about referrals between healthcare.gov, that's where people get private plans with financial assistance, and OHP, and both directions. We have a section called How Can You Help? And that section really entails and details some of the risks, some of the challenges people may experience when they are getting referred from one system to the other, and how you can help your clients and members mitigate those risks. We have a number of extra resources for you, and we plan to have lots of time for questions and answers. What we're not going to cover today is marketplace processes like financial assistance eligibility or private plan choice or enrollment. The marketplace team has lots of resources and trainings and webinars that they have put out, and so that is out of scope for today, but there is lots of information, and hopefully you all know your marketplace outreach and education coordinator, and you know how to get tapped into those resources. All right, so I wanted to set the stage for a moment to talk about why this is important. And I really think that there are some amazing plans over at the marketplace that we sometimes don't take the time to learn about, and therefore we don't know about them, and therefore it is hard to talk to our members about them when they're losing OHP. But the truth is that members are going to lose OHP sometimes, especially now that we are doing renewals. And we want to be sure, partially that you know, we're not going into really what's available on the marketplace today, but I do think it's really important because we have a tendency, when we're only helping with OHP, to maybe tune out or not really learn very much about the marketplace side of things. I think that can happen sometimes. But the marketplace has some incredible plans for folks, especially folks who are only on CALM or dental only and have some lawful presence. I actually just did a search last night, and I was looking at plans in my area and plans over in Ontario, Oregon, and plans in the metro region in Portland. And in all three areas, for somebody I just put in a 50-year-old, but I also put in a 70-year-old. In all cases, I could find plans for under $10 a month with deductibles around, $100 or $125 a month for the most part. So when we say affordable, there are affordable plans on the marketplace for people who are losing their OHP. People tend to gloss over the word affordable and even wonder, I wonder what that really means. There are plans as low as $1 a month, and that is a full coverage plan with a $125 deductible when you look it up in the marketplace at healthcare.gov. So we want to be sure that when clients might be losing their OHP, they really are getting referred to somebody for help with that other option. But if they are, there are some things that we should all know, and that's really what this webinar is about. So we'll move on right now. And I want to start by making sure that you all understand the teams that support you. So we have the OHP, over on the OHP side, we have the Community Partner Outreach Team. And we help you with your clients and your cases and your questions about OHP or Medicaid. Of course, OHP is Oregon's medical coverage that includes OHP Plus, Healthier Oregon, dental only plans, CALM and CALM Plus for non-citizens, and Medicare savings programs to help pay for Medicare costs. And we have regional outreach coordinators and statewide strategists that support you with your OHP clients. And we have a lens also not just for getting coverage, but how to improve equitable access to health coverage and services across the state. So that's your OHP stuff is served by the CPOP team. And I will pass it on to Caroline to talk about your other team that supports you.
Thank you, Deanna. So we utilize healthcare.gov as our enrollment platform. And what that does is it determines eligibility for private insurance plans as well as financial assistance. It does process that enrollment for the private plans that an individual selects and sends it over to the carrier, as well as when they potentially may meet OHP level eligibility, they are found potentially eligible, and that information is sent over to OHP for processing, and then the consumer or individual will receive that information as far as whether they are or aren't and what those next steps are. We at the Oregon Marketplace team, we assist individuals with their private insurance choice counseling as well as enrollment. And choice counseling is the same thing that community partners do. We're not licensed, we're not allowed to recommend a health plan. And we also connect individuals with free local help from Oregon-based insurance agents, as well as community partners such as yourselves. And all of that Oregon-based assistance is completely free and it's statewide.
Thank you. So I'm going to spend 2 slides now just touching very briefly on a reminder that we've had this public health emergency. And during this public health emergency for COVID-19, people have stayed on Medicaid coverage. Coverage did not end for most reasons. But beginning April 1st, Oregon was directed, and all states, in fact, were directed to begin medical renewals. That means that our 1.4 million individuals who are on OHP will now be going, they've always had to renew, but now there may be actions taken on their case due to that renewal. We have 14 months to complete this whole process of making sure that everybody who's on OHP is still eligible for OHP. And so the way we're doing that is every month we are renewing 10% of our Medicaid population. So I'm not going to go into the details of this slide, but it's a reminder that every month, 1/10 of our Medicaid population will come up for renewal. And that renewal period is quite extended, right? We have several months, we give them 90 days to respond to that renewal. If we need to close them for some reason, or if they don't respond, we give us another 60 days before they close, and then there's a 90-day reconsideration period. And this chart helps you understand those dates depending on when somebody comes up for renewal. So right now we're on that second row or that second bar. The renewal period is starting in May. We're not going to go into the details of the timeline, but I wanted to share this resource to remind us all that we are doing 1/10 of our population per month, and it's an extended amount of time. But where this webinar picks up is that at the end of that white bar right there, right, the 60-day, it's called the adverse period, we will close somebody's benefits after 60 days if they are no longer eligible or if they do not respond to a renewal notice if a response is requested. And when they close from OHP, they may be eligible for a private plan and financial assistance on what we call the marketplace at healthcare.gov. So this webinar is really talking about that piece, that after that white bar, right, what happens? We do have a link to that graphic if you would like to pull it up, but right now I think we'll go on to the next slide. And we're going to start to talk about when somebody actually, we're going to do this a little bit, maybe not in the logical order that you would think, but when somebody gets referred from healthcare.gov, so they might be thinking, oh, I'm probably going to not be eligible for OHP anymore, or maybe it's open enrollment and I'm going to apply at healthcare.gov. And they look to be OHP eligible. We're going to talk about that process, and I'm going to pass it on to and to Caroline to speak to that. But that's the first referral that we're talking about is healthcare.gov to OHP. And Caroline will take this slide. And just so everybody else knows, we have a little icon down at the bottom, the health insurance, the Oregon healthcare.gov, which is the Oregon Health Insurance Marketplace, for some of the content that is marketplace content.
Yes, thank you, Deanna. And we also have our Spanish website, Cuidado de Salud, which is definitely beneficial as well. When a person has a healthcare.gov private insurance, any change to the application, or if they renew during open enrollment, anytime the application is changed and it changes their eligibility, the individual, like I said previously, could be potentially found eligible for Oregon Health Plan. And when that happens, again, that information is sent electronically to Oregon's One system for that OHP determination. And then again, they receive their notice letting them know what steps to take next, whether they're eligible or not. And folks will receive those referrals when the individual's income is with OHP income limits. If they're over age 65, if they're over age 65 and they attest to being blind or disabled, request assistance with daily needs. And if they request a full OHP determination, that will ask them if they would like to be determined and sent over to the state for verification. And healthcare.gov does not identify or refer those who could be eligible for the MAGI expanded adult or veteran and COFA dental programs. And we'll cover that more in the How You Can Help section. So this is what the healthcare.gov eligibility notice looks like. It is definitely much more easy to read and accessible, but ultimately through the results, you can see on the right side, it's going to name out the family members of the application and whether or not they're potentially eligible for Oregon Health Plan, if they applied for the coverage and reviewed for CHIP, but likely don't meet that eligibility criteria. And it will label out the next steps in the action section. And it clearly tells them to wait for a final determination from the state agency about Medicaid coverage.
Thank you, Caroline. So I'm going to share very briefly the OHP determination process. So Caroline outlined some common scenarios when healthcare.gov will send individuals over to the one system for the OHP determination. And once that application or that change or that renewal, once we get that information from the healthcare.gov system, then the one Oregon eligibility system will attempt to process that information systematically. So it's going to take that information, it's going to run against verification sources and try and make that eligibility decision without manual intervention. However, if manual intervention is required, it's going to require that staff take a look at that information that we receive from healthcare.gov. So the staff will be alerted to that application that needs attention. They will review the information. They may contact the individual if additional information is needed, but they will go ahead and finish that application, that determination process. So that way, once that final OHP determination is made and it's authorized in the eligibility system, we are able to send that information back to healthcare.gov to let them know what the OHP eligibility outcome would be. Or I'm sorry, what the OHP eligibility outcome is. And that's important to know because, for example, if we determine that ultimately the individual is not eligible for OHP, or if we find them eligible for OHP, but only for the COWM benefit level or only for the dental only programs, that means that they can still pursue health insurance coverage at healthcare.gov. And so we would send that information about the OHP eligibility outcome back to healthcare.gov. And so that way, if additional actions are needed by the individual to complete that process that they need to do on the healthcare.gov side, they can do that and enroll in financial assistance coverage with healthcare.gov.
So in some instances, there may be a situation where there's overlapping coverage between a private plan from healthcare.gov and the OHP coverage. We definitely want to relay the information and really press that the big thing is to avoid that double coverage issue, because in the Affordable Care Act law, individuals are not allowed to receive financial assistance when they're eligible for OHP plus or other affordable coverage that is considered minimum essential. So those things are like employer-sponsored insurance and what have you. If they have double coverage for a certain period of time, which will cover what that sounds like in a couple other slides, but when they file their taxes and everything balances with the amount of financial assistance they received compared to their actual income and they had that overlapping coverage, they may have to repay some financial assistance that they received. However, it won't exceed the repayment limits that are set by the IRS. When someone receives OHP eligibility, it's really, really important as soon as possible to report that OHP coverage to healthcare.gov. And the ways they can do that is they can use community partners who have helped them with the healthcare.gov application, insurance agents. If they have an online account at healthcare.gov, they can make those changes themselves, or they can contact healthcare.gov over the phone, and healthcare.gov is 24/7, 365, even on major holidays. Some really important things to note is reporting OHP coverage does not terminate the health plan. It does terminate the financial assistance, but it does not terminate the health plan, because they do have the option of keeping their health plan through healthcare.gov, but they are responsible for full premiums, and they're not eligible for that financial assistance because OHP is affordable ultimately. If there is more than one person enrolled in that health plan, it's really important to determine how many of those family members are eligible for OHP. If at least one person needs to remain on that private health plan, they need to contact healthcare.gov to make sure that the people are removed appropriately, because if that terminate button is selected in their online account, it will remove and terminate coverage for everyone. So those are some important things to note when it comes to terminating the coverage and reporting that OHP benefit. Things like double coverage may occur when this is actually most often seen during the open enrollment period, and an individual would apply at healthcare.gov and is potentially eligible for Oregon Health Plan. They are found OHP eligible after that information has been sent to the state and the state determines them. If they have selected a health plan during the open enrollment period, then sometimes it's a crossover. Ultimately, they may be eligible, but it says they can still shop based on determination and waiting that status. So if the individual later applies or reports increased income potentially at healthcare.gov, they may be found eligible for that private insurance plan. Healthcare.gov does not communicate those changes to OHP, and in that case, OHP benefits do not close, which means the individual may end up with both OHP and the private insurance plan. And again, this risk is mostly present during the open enrollment period. And I think we're going to discuss some additional info on the double coverage.
Right. So really to emphasize what Caroline just shared, that these risks, they can occur, and the risk is definitely increased during the open enrollment period. However, there are some circumstances, some scenarios where it is legitimate for individuals to have coverage both with the OHP coverage as well as with healthcare.gov. And so what we really want to emphasize here is when that happens and they experience a change or it's time for them to undergo their renewal process, it is very, very important that they pay attention to the letters that they receive both from OHP and healthcare.gov and follow those instructions for completing their renewals. If they have a change, it's very important that they report the changes both with OHP and at healthcare.gov. And so we pointed out a couple of scenarios where this is probably very likely to happen. So individuals who are approved only for the OHP Cowan benefit, or now that we've implemented our dental only benefits, if that's the only program benefits that they're eligible for, there is the potential that they could be eligible for financial assistance coverage at healthcare.gov. And in that scenario, it is not really considered an overlap because it's okay. They don't have that full OHP plus coverage that as Caroline stated earlier, is not allowed under the Affordable Care Act. And so they can receive this type of coverage where it's not full OHP plus coverage and also have that health insurance coverage that with financial assistance at healthcare.gov. And another scenario that we want to call out is when we have families who are sort of in a mixed situation. So the most common ones would be where we have children who are eligible for OHP, and so they get to have that OHP coverage, but the income is such that the adults are over income for OHP, and so they can enroll in financial assistance coverage with healthcare.gov. So in that sort of mixed household and in that situation where someone is receiving more of the limited OHP benefits and they have that financial assistance coverage with healthcare.gov, it is going to be extra important that if they have a change, that they report it at both places. Although we have this electronic communication set up between the Oregon eligibility system and healthcare.gov system, it is not a perfect process at all. And so the safest thing to do is to have these individuals report changes and complete the renewals at both places, and also to make sure that they pay attention to all these letters that they're getting both from healthcare.gov and OHP. All right, so now we are going to pivot now and talk about the reverse of that scenario when an individual applies directly with OHP and then they get referred over to healthcare.gov. So there are many ways that individuals can apply for OHP. So whether that's through the applicant portal on the Oregon eligibility system, the one system, or they can apply by mail with a paper application. They can call in to the call center. They can go into a local ODHS office. Regardless of the method that they use, if they apply for OHP directly with the state and we do not find them eligible for an OHP plus benefit, then they could get their application information referred electronically to healthcare.gov. So we would do that for those who are coming in, applying brand new and not currently receiving OHP, and also for those who are currently receiving OHP and are no longer eligible to continue to receive their OHP plus benefits ongoing. So in both those scenarios, we would go ahead and take their information and electronically send them over to healthcare.gov, so that way they can explore other options for coverage. Some common scenarios when we would make that referral to healthcare.gov is, of course, when their income is over the OHP income limits. If they are a lawfully present non-citizen and are only eligible for the limited emergency Cowan benefit medical package. If they're only eligible for the dental-only benefits, so that's the COFA dental and the veterans dental benefits. Or if they move out of state. Those are the common scenarios where we would go ahead and refer an individual to healthcare.gov. It's also important to note some very specific scenarios where we would not refer that individual over to healthcare.gov. So the first of which is that we need additional information from them in order to make a final eligibility determination, whether it's because they submitted a new application, whether it's because of a change in circumstance, or whether it's because we are renewing them. When we do not receive all of that information that we need to make that final eligibility determination, then we can't determine if they are going to be OHP eligible or not, or could be potentially eligible for financial assistance with healthcare.gov. And so in that scenario, we would not refer these individuals to healthcare.gov. Additionally, if the individual decides they no longer want to apply for OHP anymore, or they decide they want to go ahead and voluntarily close their OHP benefits, we're not going to refer these individuals to healthcare.gov as well. And then on the application, and including the applicant portal, there's a question that asks if the individual has one of the immigration statuses below, and there's a bulleted list of all of these different types of immigration status. If they answer no to that question, we will not refer these individuals to healthcare.gov as well. So we just wanted to call out some very common and specific scenarios where that referral would not happen. But if the individual does get referred, they will be notified with their OHP notice. So here's a sample notice that we wanted to share with you. This specific example is for this scenario when the individual is over income for OHP. And so you can see that in the closed section of the notice, we identify these individuals, why we're closing their benefits down, when we are closing their benefits, and then we'll have a blurb underneath that to let them know exactly who we are going to close down, but refer them to the Your Next Steps section, because the Your Next Steps section gives them additional information about that referral. And the little screenshot on the lower right-hand corner of the screen, that's what you will find in the Your Next Steps section, where it gives them information about that referral that will be done through the one system. It gives them contact information, so that way, if they have questions, they know who to call. They can even go ahead and go to healthcare.gov online and start their process with healthcare.gov once they are informed that their OHP coverage is going to be ending. So all of this information is there on their OHP notice. And I'm going to turn this slide over to Caroline.
Thank you. Absolutely well said. So to avoid a gap or overlap in coverage, both are very important. So things that we want to keep in mind when the individual loses OHP and is referred over to healthcare.gov. The individuals that are losing OHP will have 60 days before OHP benefits close to apply and enroll in that private plan to not have a gap in coverage. Ultimately, they would receive notice from OHP prior to their benefits closing, which would allow them to go in and do their application and select that health plan. If the caveat to that currently is with the public health emergency unwinding special enrollment period that is going to be open until July 31st of 2024. If the individual is no longer eligible during this unwinding redetermination process, they do have until that July 31, 2024 date to apply through healthcare.gov. However, once they submit their application, that 60-day clock does start. If they miss that 60-day clock, then they may be potentially out of selecting a health plan until the following open enrollment period, which would be November for the following January coverage. So the individual does have to complete and submit an application at healthcare.gov and report that loss of minimum essential coverage. And they would receive a notice from healthcare.gov letting them know you were found ineligible for state Medicaid and you need to come and complete this application. In some cases, there is an application ID already on that notice, but they need to complete a new one. If they use the pre-populated one from the data received, it could cause issues and delays in processing. So it's really important just to start a clean, fresh one. It will ask specifically if they are losing coverage or have lost coverage. And again, in order for that seamless coverage and to avoid that gap, they'll want to put in the future end date in the event that they go in and apply prior to their benefits closing. And it's really important for them to keep the OHP closure letter because they may be requested to submit proof supporting documents to healthcare.gov that does show that they lost their coverage.
So we just gave you all lots and lots of information, and we really wanted to make sure that you understand at a high level that back and forth interaction between the one system and healthcare.gov, and then not only that, but the next steps afterwards that happens. So that way they can get that final OHP determination and they can make sure that they complete that process to to enroll in financial assistance coverage with healthcare.gov. And it is a very, very confusing process. It is not an easy process to navigate at all. And there's notices, lots of notices coming from multiple places for our individuals who are experiencing these back and forth referrals. And so we understand that this is not the easiest process to navigate. And so we want to equip you with the information to understand that process, but also your role in this. So we have some very specific scenarios that we wanted to call out, because these are some of the common scenarios that we've heard about and you've shared with us, or we've heard from our staff out in the local DHS office, as well as the eligibility centers. And so we want to make sure that you are aware, because some of these scenarios they're just going to be unavoidable, but there are things that we can do to help support our members. So with that, the first scenario that we wanted to address, so Deanna touched on it already, that we have this new MAGI expanded adult program. And of course, there's that resource there that you can go and check out for the webinar that was previously provided, so you can get more information about this program. But with this new program, it increased the income limit for our existing OHP adults to up to 200%, through 200% federal poverty levels. So instead of the 138% cutoff, it is now 200%. And so that kind of sweeps into the income range for financial assistance coverage with healthcare.gov. With this new program, however, those who are eligible for Healthier Oregon benefits are not eligible. And this being our program that is just brand new implemented as well, healthcare.gov, although healthcare.gov knows about our OHP eligibility rules, they do not know about this program. So they do not have a way to assess if somebody could be eligible for the MAGI expanded adult program. And so some risks because of this gap in information with healthcare.gov system is that if their income is within this 138 to 100% FPL income range and they go to healthcare.gov, they could be found eligible for financial assistance coverage with healthcare.gov, when potentially we could actually keep them on OHP through this new MAGI expanded adult program instead. The other risk is that potentially we do go ahead and transition them to the MAGI expanded adult program, and they also, with knowing that they have an increase in income, go directly to healthcare.gov and is found eligible for financial assistance coverage with healthcare.gov, creating this overlap. And so this is a scenario to look out for. We have a few other scenarios about the overlap, potential for overlap that could happen, and we'll give you some guidance as to what to do. So the next scenario, Healthier Oregon. Great thing that we're doing for our state by expanding coverage to our non-citizen populations. But unfortunately, healthcare.gov also does not have the eligibility rules to recognize that somebody could be eligible for Healthier Oregon benefits. And so with Healthier Oregon being OHP plus coverage, that means that they are not eligible for financial assistance coverage with healthcare.gov if they are receiving or Healthier Oregon benefits, since it's OHP plus. And so with the gap in healthcare.gov's eligibility system, not knowing about Healthier Oregon, again, we run into that risk where there is the potential that somebody could be found eligible for financial assistance coverage with the healthcare.gov, while we actually find them eligible for Healthier Oregon. And then that again creates another type of overlap in coverage, putting the risk for the potential of having the tax credits that they've received needing to get paid back. And another scenario with our new dental-only programs, that were implemented, as well as for those who are found eligible only for the CAWA benefits. So we talked about this scenario earlier about how in this type of scenario, it is absolutely appropriate for these individuals who only have these types of OHP benefits to be able to get that healthcare.gov financial assistance coverage. Absolutely appropriate, because there really is no overlap at this point. But we do want to emphasize again that if there are any changes that they experience, they need to be reporting these changes at both places, because it is not always a guarantee that information sharing back and forth between the one system and healthcare.gov system, that it's going to happen. Again, that connection exists, but it is not a perfect connection at all. And so the safest way is to have these individuals report changes at both places. That also means that when it comes time for them to renew, they will need to complete the renewal process at both places, and the renewals may not always align. And so it is, again, very important that they pay attention to the letters that they receive from both places, so that way, if there's actions that they need to take, they can be sure to take action with the right type of coverage at the right place and time, so that way they don't lose out on benefits that they are eligible for. So with this next slide, I'm going to pass it to Caroline, and she's going to really tie in that piece about what to do when there is that overlapping coverage, and with the two scenarios that I mentioned earlier, for those who are found eligible for an OHP plus benefit, as well as they're getting that tax credit at the same time.
Yes, absolutely. Thank you. When we encounter individuals that are in that situation of overlapping OHP plus coverage, as well as enrolled in a private health plan through healthcare.gov and receiving that financial assistance, again, as we mentioned previously, they may have to repay some or all of the tax credits when they file their taxes for that year. And of course, it's subject to the repayment limits set by the IRS. As long as, and this is really important too, as long as they terminate their healthcare.gov plan in the same month that they first received notification of their OHP eligibility, which is typically, the month that it's dated, they will not have to repay tax credits. More often than not, there is going to be at least 1 month overlap. OHP's determination goes back to the first of the month in which they applied, I do believe. And so you will see that. In healthcare.gov, when the plan is terminated same day. And ultimately, as long as they report it immediately within the same month that their eligibility notice is dated, that month of time, they will not be responsible for repaying. In some instances, the same thing would apply when there's a couple months or maybe 3 months overlap when there's significant processing delays and what have you. So if coverage backdates, 2 or 3 months from OHP and they receive notice, they terminate their coverage at healthcare.gov. During that overlap, they will not be responsible. But if they wait another 6 months, they will be responsible for paying some or all of that back based on those repayment limits and their filing status. So you can help them by contacting the One Customer Service Center, local ODHS office, or your marketplace outreach and education coordinator. If you're not sure who that is, you can definitely call the marketplace or email us. We would love to get you connected to the appropriate person that supports your area. And between ODHS and us at the Oregon Health Insurance Marketplace, we can definitely work together to assist folks in that situation on a case-by-case basis. So speaking of the repayment limits, this is for tax year 2023. So in the current plan year, it is 2023. If someone has that overlap, when they file next year, they may see these overpayments, but these are the limits. So if a person is under 200% of that SPL, If they're a single taxpayer, they won't be required to pay any more than $350 towards their overpayment of tax credits they received. Any other taxpayers, it does increase to $700. And you can see only at 400% of the federal poverty level and above, there is no maximum, there is no limit, there is no cap on what they would be required to pay back. They would be required to pay back all of the tax credits they received in excess to what they should have been eligible for based on their actual end of year income.
Right, and I'm going to chime in here with some reminders. So thank you, Carolyn, for covering the risks there, but also the limits to those risks. I think for all of us, the upshot is that people really need to look at their notices. They need to make sure that if they have coverage in both places, that they're taking care of that. And so as a community partner, what we hope you can do is help them understand their notices and help them determine if they have gotten any from healthcare.gov. It can be confusing to be getting notices from both places, especially if you're not you don't have a handle on exactly what kind of coverage you have. But that is the best way, by looking at those notices and determining if you have coverage in both places. That is going to be the best way to avoid having to pay back some of those tax credits. Some of the other things that you can do is you can help make sure that every time people come to talk to you, you verify their current address, phone number, and other contact information, and take a moment to update that in the system wherever they are getting coverage, right? So if they are also on marketplace coverage, that will also need to be updated at healthcare.gov. And then there's a last reminder here that I put in that I think can be very hard, right? Members can, of course, find their own notices, their own electronic notices in the One Applicant Portal if they create their own account. That is a barrier for some people. And for others, it may be worth it to take the time to show them how to access their own account. We know that it's easier just to help them with your account, but to take that extra time and show them how to be self-sufficient, to find their own notices and even report their own changes can be a real benefit for them. So we do know that it takes extra time. And for some clients, it really may be quite appropriate to help them do that. So those are some reminders that we wanted to throw in. And of course, there are more that many of you can think of, but the more you can do to help them understand if they have both coverages and how to make sure they don't end up in any of these risk categories. We really appreciate it, and so will they. And now, this is a little side note. It may seem out of place, but it very much falls into the discussion of when people are moving from one type of coverage to another. We do lots of choice counseling on the OHP side when it comes to people who have multiple CCO options. And if you're a marketplace assister, you may also do choice counseling about private plans. And in some regions of Oregon, we have a coordinated care organization that also offers private plans. Right off the top of my head, I can think of MODA, Pacific Source, Providence, Kaiser, and we wanted to remind people that if people are moving between the two types of coverages, that they may want to continue with their provider and have continuity of care with that same provider, and that may be possible. It may not be, because not all Providence providers take both types of Providence, for example, private and OHP. But if people are moving from a CCO to a private plan, you can help them work with their agent or their insurance carrier for guidance on how to maintain that continuity of care if they would like to keep seeing their provider. Likewise, if they're moving from a private plan to a CCO, they can call their CCO for guidance on if they can maintain that provider relationship. So we just wanted to throw in an extra note about that other piece that may be relevant in some parts of the state. Now we're going to talk about some resources for you to make sure that you have additional information if you need it. There are, of course, more resources in this, but we have a marketplace transition page for links to the Marketplace Transition Project and a really great and robust frequently asked questions. So we really recommend that everybody, whether you're doing Marketplace assistance or not, goes to look at that. Of course, you can call the Marketplace team for questions, and they're incredibly helpful. We have the OHA Unwinding page. We have a link to our past CPOP webinars. We mentioned Healthier Oregon, so we have a link to the Healthier Oregon program page. We have a special enrollment period provision during this unwinding time that we referenced, and so we are providing a link to more information on that. And in case you need a list of your Oregon CCOs, we've provided that as well. We have more redetermination learning series for OHP assisters, so we're putting some links here, plus the larger PHE, Public Health Emergency Unwinding partner and provider webinars. We have lots of learning opportunities for you. And back to the Marketplace, and then a quick wrap up.
Thank you, Deanna. So we have a resources page, and in that resources page, there is information for community partners regarding our trainings for special populations, supplemental webinars, and all kinds of great information. And you can view our Marketplace supplemental training catalog to find more trainings from us at the Oregon Health Insurance Marketplace team, and our website, OregonHealthcare.gov, and the resources tab. Just go down to community partners, open that up, and there's a bunch of helpful information there. You will also find forms, FPL charts, outreach materials, rack cards, a whole slew of materials that can be used by you guys, and you can order them right there on the website if you find something there that you would like to have in your office.
Thank you. So we have gotten many questions, and luckily we have a whole team of people answering them. They have largely been answered on the back end, so hopefully you've all been following that question and answer. But we will also make this slide deck available on GroupSite. It is 12 o'clock, so we want to say thank you for attending today and for being here. Thank you for learning with us, and thank you for all of your questions, which also help us know more about our system and how it's working out there for you. Please reach out to your Marketplace coordinator or your regional outreach coordinator at CPOP if you have more questions. We will send out a follow-up after this with the slides, and we appreciate you being here and everything that you do for your clients. So thanks to everyone, and thank you to our subject matter experts for supporting this, and have a wonderful Tuesday. Thanks all.